My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, focusing on cosmetic plastic surgery. One of the questions I get a lot is, what is a mommy makeover? And it's a name that has come up frequently of late. Essentially what a mommy makeover is a combination of some type of body contouring procedure and some type of breast procedure. The most common combination would be perhaps a breast augmentation with a tummy tuck. Those are both areas that tend to need some help after childbearing, and so a tummy tuck is really the gold standard in rejuvenating the abdomen of someone who's had children. Breast augmentation can help fill out a breast after the childbearing has caused a loss of some of that volume. It can certainly be combined with a lift. Other breast surgeries can be performed at the same time. So sometimes a patient has too much volume and they can have a reduction. Sometimes a patient has an appropriate amount of volume and they may only need a lift as opposed to an implant as well. Patients will often ask us if it's safe to combine different procedures together, and there's a drive to do that. Everybody's busy, and so one of the more challenging components of getting surgery performed is, how do you fit a recuperation into a busy lifestyle? Especially if you need a mommy makeover, presumably you have children. And so especially if you have younger children, how do you fit a week off or 10 days off into caring for your family at the same time? And so most commonly, patients will schedule things together if they can. It is safe, been proven very, very safe to combine abdominoplasty surgery with breast surgery in the same setting. However, there are certain things you want to be aware of. My preference is not to schedule more than 8 hours of elective surgery, and so although you can perform tummy tucks in combination with breast surgery, it's not necessarily an opportunity to do everything that you might have on your bucket list of surgery. Very commonly, if someone has multiple areas of concern, typically after massive weight loss or something along those lines, we may break it up into 2 different days of surgery for safety. Safety is obviously always of paramount importance, and although efficiency in terms of surgical recovery and cost is very important, you never want to sacrifice safety for that. We have our own surgery center, and part of the reason that we bought a building and built out our own surgery center was to really specifically control every aspect of the patient experience. And so we're AAAHC certified center, meaning we have everything available at every outpatient surgery center that you might work at. We have our own medical director who's a board certified anesthesiologist. He supervises all of our other anesthesiologists, all of whom are board certified. It is perfectly legal in Colorado to have nurses perform anesthesia for you. We chose long ago to limit our anesthesia providers to physicians. Every now and again, you're glad that you have someone with additional training. I've never been in a scenario where I wish that my anesthesia provider was less skilled or less trained. And so our medical director is typically overseeing the anesthetic portion of the case, and then we are responsible for navigating through the surgery itself. But mommy makeovers work very, very well, and that you can have someone come in one setting really undo what 2 or 3 pregnancies have done, and get those patients relatively quickly back to their lives, but feeling much better about themselves. It's great to be able to do that for somebody.